Okay, folks, let's talk about more cardiac meds, okay? So first, let's start off with the HMG-CoAs inhibitors, okay? I just remember as HMG statins. Pretend you're a Valley girl. Statins, okay? Your HMG are your statin meds, okay? So it is your simvastatin, lovastatin, things like that. And the HMG, I each gave those a phrase or something to help you remember what the med does and what its effects are, okay? The H is for high HDLs, okay? It's going to raise your HDLs, but it's also going to lower your LDL, so it's going to get rid of all that bad cholesterol. The M is for muscle soreness or rhabdomyolysis, and that's very important. It's a very serious side effect you can have from the medication. Okay, and then there's grapefruit juice is my G for no grapefruit juice. You want to avoid it while they're taking that medication. And if you remember, HDL is like your Drano. So HDL is the Drano in the pipes going through your pipes per se or your vessels, and it's clearing out all the gunk and letting it flush more. So with the HMGs, the statins, it's going to reduce your bad cholesterol, your LDLs, and it's going to raise your HDLs, get that Drano moving, get things cleared out, and help your cholesterol balance out. It's also going to decrease your triglycerides. So rhabdomyolysis that's that muscle soreness we talked about. That can be fatal, so that's why it's very important that you are watching your patient for that. And the grapefruit juice can actually just make the med more toxic. So that's why, I know you're probably wondering why grapefruit juice, why can't they have it? Well, because it can make them go toxic. Okay, now let's talk about bile acid sequestrants. If you think about when something sequesters something, it like groups it together or sequesters it together. So I just remember it as the bile acid sequestrants will sequester the bile acids together, gets them all together, converts the cholesterol to bile acids, therefore lowering your cholesterol. So really how I think it out, I know this is going to start to sound a little bit gross, but the bile acid sequestrants binds all the bile acids in your intestines, causes you to poop them out basically, and then that causes your liver to produce more bile acids. So when your liver detects that you don't have that many bile acids, it starts making more to replace what it was lost. In order to produce more bile acids, it has to use cholesterol to make those bile acids. So you pooped out your bile acids, you're low, your liver's like, oh no, I gotta make more. So it collects all the cholesterol it can find to make more bile acid, therefore lowering your cholesterol. Okay, sounds weird? Yes, we talked about poop. I figured it would be coming soon. So your bile acid sequestrants, right, it lowers your cholesterol, so you want to think about choles, like C-H-O-L-E or C-O-E, to think cholesterol, and that's how you can remember the name of the drugs. So there's several of them. There's cholestyramine, cholestyramine, cholecevamol, or Welchol is kind of the names. So cholestyramine is questrin, and if you think sequester, sequestrants, questrin sounds familiar. That's how I remembered that one. And if you think about if it's sequestering all this bile, right, and just think it's sequestering the bile acids, think kind of like gross bile. How would you feel if you were bilious? You would have nausea, vomiting, constipation, and bloating. So those are some side effects. But one of the biggest ones, those side effects will go away. They're temporary, but one of the most serious side effects of this medication, if you think sequestrant, bile acid sequestrin, think tin, sequestrin, and tinnitus. So tinnitus is the ringing in the ears. That stays, and that's a pretty serious side effect also. So let's see what else we can cover here. Okay, so let's talk about aspirin, okay? Aspirin is not a blood thinner. It inhibits platelet aggregation. So it basically inhibits those platelets from sticking together and clotting and makes them kind of slippery so that you're not getting clots and issues. Okay, some side effects with aspirin, it can cause liver toxicity and also hearing problems, ototoxicity. Those are the two main effects. And if you're taking aspirin, you don't want your patient or you taking the NSAIDs, which is ibuprofen, Motrin, Aleve, any of those NSAIDs you don't want to take with aspirin. Then there's an antiplatelet platelets called Plavix. You probably heard the commercial on TV. It increases the flexibility of the red blood cells. So instead of them binding and getting clotted up, it kind of helps their flexibility. It prevents them from clumping together. If they're on Plavix, you want to monitor a CBC with the platelets just to see if they're losing too many platelets, what their blood levels are. Okay, and with Plavix too, you could possibly, you are decreasing your platelets pretty much, so you want to watch and make sure they're not at risk for bleeding. And I think that's it for now on the cardiac meds. Enjoy.